In Ophthalmology Clinic of Nairi Medical Center, we perform surgical treatment of retinal pathology with successful results in accordance with the world standard. In cases of strong adhesion, connection of the retina and vitreous body, the posterior detachment of the vitreous body leads to traction of the retina, and so the vitreous body begins to pull the retina in certain places. If the retina itself is thin in these areas, it can lead to ruptures, which will allow the intraocular fluid to pass through and detach the retina from the underlying pigmentary epithelium. In most cases, it is impossible to determine when there is a risk of detachment of the retina until the detachment has actually occurred. Physical symptoms manifested in the form of flashes of light, a large number of flies, or loss of the peripheral visual field may not be noticed by the patient until a veil appears and it may reach the central vision. Without urgent surgical intervention, which is desirable to be carried out within 1 to 2 weeks after detachment, the detached retina becomes less elastic due to the fact that the pigment cells begin to form a membrane on its surface. The main goal of surgical treatment is to close the ruptures of the retina in order to stop the penetration of the eye fluid through it. To close the retinal rupture or ruptures, the surgeon first needs to detect them, and their size is not so important. The rupture edges are fixed to the pigmentary epithelium with the help of microscars. In order to form these scars, first it is necessary to cause an inflammatory reaction at the edges of the rupture. This is done with a laser, causing microburns or cryopaxy, causing microfrostbite. While the inflammation forms microscars, the retina should be pressed in the rupture zone to the pigmentary epithelium. This can be done in several ways. The doctor can locally press the outer wall of the eye, the sclera, pushing it to the rupture with the help of special filling. Simultaneously with pressing sclera in the rupture zone from the outside, as a rule, the air bubble is injected into the eye in order to press the retina to the pigmentary epithelium from the inside. This bubble will naturally be dissolved in the eye in the future. In more complex cases, a silicone bubble is used instead of a gas bubble, which tightens the retina from the inside even more, but the silicone itself doesn't dissolve in the eye and is subsequently removed from the eye during an additional surgery. The possibility of an unsuccessful result after the surgery is always present because the surgeon cannot calculate all the options that can arise in each individual case. If everything goes well, patient can expect a return to everyday life. Improvement of vision occurs from 3 to 6 months.